step into the room, I'll review the chart, check for diagnosis, any allergies or anything that would hinder the assessment process. I will gather all my supplies before I walk in. I'll knock, walk in, introduce myself. Hi, my name is Carrington. I'll be a nurse today. I'll be performing a head-to-toe assessment on you. It'll take about 20 minutes. Perform hand hygiene, gather all my supplies up here, check the wristband with the patient. Can you state your name and date of birth?
Jessica 52993.
I'll do a neuro exam. Do you know where you're at today?
Tulsa Tech.
Do you know why you're here?
Head-to-toe assessment.
And do you know the date?
May 1st.
Yes. And then I will start the head-to-toe assessment. I'll start with the hair, check for brittleness, any dryness, any signs of bugs, and anything wrong with the hair or the skin. Move down to the face, check the skin. It looks moisturized, pink, and normal. There's no signs of lesions or rashes. Go to the eyes. Follow the pin. Pupils look equal, round and reactive. Eyes are symmetrical. There's no signs of discharge, redness, or jaundice. I'll move down to the nose. I'll check inside the nose, check to make sure the septum isn't deviated, and check for any bleeding or any type of discharge. It's also symmetrical. I'll go to the ears, pull up and back and check inside, make sure there's not any discharge, any bleeding or earwax. Make sure she can hear this, make sure she can hear this. Move down to the mouth, check for the lips, make sure they're not dry. Check inside, make sure she has, her teeth are symmetrical and that she has all of them. Check the tongue, the gums, the color and smell, and the mucous membranes. I'll have you check for patency with the nose, take a deep breath in, and check the other side. All skin and everything looks normal and symmetrical. Move down to the neck. We'll have you look up and down and side to side for range of motion. I'll check the lymph nodes for anything abnormal. I'll check the carotid for a minute on each side, not at the same time, and then I'll listen. Okay. And skin looks normal, no signs of bruising, rashes, or lesions. Move down, I'll have you take a deep breath for me. Respirations look normal, depth and range looks equal. I'll check the breasts, those are equal, symmetrical, no signs of lumps. I'll listen for lung sounds. And on the sides. And then I'll listen to the apical heart rate for a minute. Okay, so that's good. Skin looks normal. There's no signs of rashes or lesions or anything wrong with it. We'll move down to the abdomen. I'll inspect it first, make sure it's the contour and the color and the shape of it is normal. And then I'll listen for bowel sounds in all four quadrants. And if I don't hear any, I'll listen in all four quadrants for a minute before I report any abnormal findings. And then I'll slightly palpitate the abdomen. If you feel any pain, please let me know. I'll have you sit up for me and I'll check your back. I'll check the spine for any signs of scoliosis, lordosis, or kyphosis. Skin looks normal. It's pink and no signs of lesions or rashes. I'll listen for lung sounds. I'll have you lay down for me, thank you. Now I will check the upper extremities. I'll do range of motion on the shoulder, the elbow, and the wrist. And I would do that on both sides. I would check capillary refill, hold for 5 seconds, wait for 3 for it to refill, check strength, and then a minute of the radial pulses, check sensation, and then I would check for any signs of edema, and skin looks normal. And that's good. I'll move down to the perineal area, ask when's the last time you voided, when's the last time you used the restroom,
This morning?
any signs of any discharge or pain or burning.
No.
Check the area for any discharge, bleeding, lesions, or bugs. When's your last menstrual cycle?
Last week.
Then I would check the rectum, make sure there's not any discharge, lesions, bugs, bleeding, any of that. Check for hemorrhoids. And when was your last bowel movement?
Yesterday.
Okay, skin looks normal. Move down to the lower extremities. I will do range of motions on both sides of the hip, the knee. I'll have her push against me and pull. While I was up here, I would have checked the femoral pulses, the popliteal pulses behind the knee, and then the posterior tibial pulses on the inside of the ankle, pulse on top of the foot, capillary refill on the feet, sensation on the legs, skin looks normal, no signs of lesions, rashes, bruising, anything like that. Put the bed back in the normal position, make sure she's comfortable, give her the call light. Is there anything else I can help you with today? Thank you for allowing me to take care of you.
Thank you.
Exit, wash my hands, do hand hygiene, chart any findings. That's it.